So thank you for those who are tuning in or those who watch this later. I'm the Associate Director here with Karen Marsh and Aaron Varum. We make Theological Horizons. We're a community that connects faith, thought, and life based at the University of Virginia. And this is a series that used to be a lunch series before COVID and now is back to being a lunch series because it's just so great to have food and friends. So for those that are in person, we're glad to feed you Pearl Island. Thank you, Pearl Island, for catering it. So feel free to grab your food and find a seat, but we're going to get started here with this candid conversation with the Webbs. We're so grateful that they are both able to be here. It's just such an honor. And I am so honored, too, that Cameron Crowder, who is one of our Horizons Fellows, is going to lead the interview. She's going to ask some questions of the Webbs first, and she's going to introduce them, have a conversation, and then we're going to open it up to you all to ask questions. And we're going to try to wrap it up by 1:30, so I'll keep an eye on the time. But first, I'm going to introduce Cameron and tell you a little bit about her. Cameron Crowder is a fourth year from Dallas, Texas. She is majoring in human biology, and she's on the pre-med track. She's a Horizon Fellow and is passionate about fighting to overcome health disparities in minority communities. She also enjoys dancing, singing, writing poetry, and playing games with friends and family. So welcome, Cameron and the Webbs. Thank you.
Thank you all so much for being here. Thank you to the Webbs for being here too. It's great to just have this opportunity and this honor. And so I'll just give a brief background about both the Webbs. So for Dr. Lee Webb, Dr. Lee Webb graduated from UVA School of Medicine in 2009 and the Darden School of Business in 2019. She currently works in emergency medicine at the UVA Medical Center, both clinically and as a professor. And she's also a co-author of a COVID-themed children's book called We Are Going to Be Okay. And then Dr. Cameron Webb also attended the UVA School of Medicine and is a physician and lawyer working at the intersection of health and social justice. He is the director of health policy and equity in the Department of Public Health Sciences and also practices clinically as a hospitalist in the Department of Medicine. He is also currently the White House senior policy advisor for COVID-19 and equity. And they are both wonderful parents to two amazing children. So let's give them another round of applause. And so the first question that I have for both of you is, how have your individual upbringings and backgrounds influenced both your career pursuits and your faith journeys? And take as long as you need.
Well, before we get started, Cameron may have some Wake Forest School of Medicine folks tuning in, so that's where he went to medical school. We both went here for undergrad, though, to University of Virginia. That's actually where we met and were friends for many years before we started dating. So
that means I was in the friend zone.
Friend zone for many years before we started dating.
Living proof you can fight your way out.
It's true, it's true. So in terms of me, I'll start if that's okay. So I grew up in a very small town, about an hour and 15 minutes from here, Appomattox, Virginia. Some of you may know it. It's the beginning of the end of the Civil War, where Lee surrendered to Grant. And so that's where I grew up. My dad actually was a pastor. He started a church there many, many moons ago and pastored it for about 40 years before he retired 2 years ago. And so I think I know I was immersed in faith and service from a very young age. He actually started the church maybe 1 year before I was born, and so I attended church 2 to 3 times a week, and I attended service activities probably every other day of the week where I wasn't attending church. So I was kind of fully immersed in that experience. And I do think that between him and my mom, that's why my sisters and I are so service-oriented now. And I don't want to sort of make this correlation between going to church and, having faith, because I think that may exist for some people, but for a lot of people it doesn't. However, I think that was a really strong foundation for my Christianity and the faith and the service that I have now as an adult. So it's just kind of like always part of I didn't know any different. I thought every family was like that. And then people, even now, will be like, you volunteer so much. And I'm just like, but I thought everyone was sort of service oriented. And that was my lens growing up. Yeah.
Yeah, I think for me, I come from a pretty big family. So there are 6 kids in my family, my 2 parents. And so we went to church growing up, but we took up a whole pew. So I mean, it's hard to work that out some weeks, particularly around Easter. And so I think for me, I would say faith was always kind of an organizing principle in our family, in the sense that it was a part of our conversations. It was a part of the structure that my parents provided for us. It was the lens through which we understood morality, the lens through which we understood how to relate to people interpersonally. And my mom is a very spiritual person, and so I think it was always kind of infused in our experiences. I do think that similar to Leigh-Ann, I think that was connected to why service became such a thread in our family. All of my siblings, in some form or fashion, were in service. I had two brothers who worked in government. I had a sister who's a nurse. I have a sister who's a teacher. My youngest sister is a lawyer. We let that pass. But I think that all around, that came from my parents. My dad was in law enforcement. My mom was a teacher. And when you put that together, I think that idea of service always being at the forefront, definitely was rooted in our faith. But again, I'll go back to that construct of it being an organizing principle for the way that we navigated life, because I think that we always go back to it. It always became a part of how we understand situations, and life is hard, and there are always challenges, and there are moments that are frustrating, and I think that in our family, kind of going back to the grounding of our faith was important. And as we've gotten older, especially linking up with the PK, I think you definitely see how that can be a really huge benefit to a family structure and to our lives moving forward.
Great. Thank you so much for both sharing about your backgrounds and upbringings and your faith. And so this question is for Dr. Leigh-Ann. Could you explain some of the ways being a physician has impacted your perception of the world, your sense of self, and your faith?
Yeah, so 3-part question there. If I don't get to some of the parts, just remind me. So in terms of my perception for the world, I will say that I'm not surprised about anything anymore, because we see so many things in the emergency department. I think being a physician is a really unique and also very privileged space, because people come to us and they give us information that they may not be sharing even with their loved ones at home, or certainly not their friends and family, or broadcasting it to the world, right? So we are privy to this very private space, both from like a mental health standpoint and a physical standpoint. Even when we do physical exams, like, you all allow us to touch you in ways to help you to help us diagnose you with things that you come in, right? So I consider it a very privileged space. And in that space, I think there's, sort of the mental health, there's physical health, and I'll say like spiritual health is kind of separate, or can be separate from those things. But there's an intersection between all of them. And so in terms of the way I see the world, I see a little bit of that every single day. And everyone in medicine knows that the emergency department is like the window to the soul of the problems of our country, right? And so, poverty, we see that every day. We see a lot of homelessness. We see a lot of even the effects of policy, right? So people come in without health insurance. We see them in the emergency department. Gun violence, we see that in the emergency department. Just about everything that you can think of from a policy standpoint, from a world standpoint, we have just like a first row seat, fortunately or unfortunately, to that in our practice in the emergency department. And I think that is very humbling. It definitely makes me want to be a better person and a better advocate, right? And I know we can't change everything in the world, of course. We all have our little niches, policy, me more so community service. But I think that drives me to continue that, sort of service that we talked about growing up, and that foundation that drives me and pushes me to continue in that direction, because we just see so many not nice things in the emergency department. I also try to live in the present, and I was really bad about that for a really long time. And then my mom passed away about 2 years ago of colon cancer during the pandemic. Between that and the pandemic itself, and just seeing so much death and dying, it has really pushed me to try to live in the present. We see a lot of unexpected death. Expected death is hard. Unexpected death is also hard. And in some ways, it is Also very, not in some ways, in all ways, it's also very difficult for families, right? They're like, we always talk about the patients and how hard it is for them. And I think in the emergency department, we also deal a lot with families who are very stressed, right, around critical illness of their loved ones, who are very stressed and who also need attention and care. And I think that's where some of that, more of that like spirituality comes in. We have a very good chaplain department and services at University of Virginia, and they help us out because obviously we are only one people or one person. I am only one person. I have a big team in the emergency department, but I'm only one person. And so everyone who can help on that team to take care of someone, whether it be myself, a chaplain, a resident, a nurse, a tech, the more the merrier, because there's a lot to be taken care of there. So we do try to integrate spirituality into the care of patients if they're open to that, right? Some patients are not. And then what was the third question? I feel like I'm rambling at this point.
I think your sense of self, your faith in the world, I think those are all.
Got it.
Yes.
All right, I'm gonna pass it on to you.
Yeah, thank you so much for answering my 3-part question. And then for Dr. Cameron Webb, along with like being a general internist physician, you hold a JD. And so what are some of the unique ways you've seen medicine and law intertwine in your life?
Well, so law means a lot of different things. And first, you can call me Mr. Doctor and her Mrs. Doctor, and it works.
Yeah, it does.
It's interesting because going to law school, being a lawyer, it's a really unique skill set. I would say it's just a really good kind of broad education in how to think, how to advocate, how to engage. And so for me, a lot of my work in the law comes through policy. That intersection, as Leigh-Ann alluded to, you see it every day in a clinical practice. You see where policy meets real life, and you see the impacts. I think, that's on steroids with this pandemic, right? We see the very real impacts from a moment-to-moment, day-to-day, week-to-week, dynamic with how policy impacts people's real lives. I think that medicine and law intersect every day in the policy space for sure. People used to always joke when I said I was going to get an MD and JD. They were like, "You want to, represent yourself if you get sued?" And I was like, "Ha ha, very creative." That's the first time I've heard that. But I think that more broadly, we really do. I think there has to be more of that perspective of advocacy and of smart design, in medicine and healthcare. I think I always differentiate when we talk about medicine. I think about that clinical practice, right? When we talk about health, I think about the experience of an individual in community that's shaped by where you're born, grow, live, learn, eat, play, and pray. And when I think of healthcare, I think of the system that was structured and was designed to have that impact, connect medicine to the health of people. And so I think that you definitely see a lot more of that policy interaction at that healthcare and law. But I think that's where, for me, I kind of lucked into it in some ways. I knew I was passionate about social justice, and that's what drew me to the law. I knew I was passionate about healthcare, and that's what drew me to medicine. And I happened to start law school the year the Affordable Care Act was passed. And so I dug in deep on the policy. And so I think for me, my indoctrination is deep. I believe that the policies that are created shape the opportunities people have to get and stay healthy. So certainly see the overlap, but I think that we're at a unique moment right now where we need to lean into that a little bit more because a lot of people are struggling, are suffering, and we have tools in our society vis-a-vis policy to change that.
So the deep immersion, I was also in residency at that time, so he could really go all in on health policy for the 3 years that I was in residency and he was in law school. I was like, enjoy yourself. I'm not home anyway. I'm working 80 hours a week. So it was good times.
Yeah, that's great. Thank you so much. And then going back to Mrs. Dr. Webb, along with being an emergency medicine physician, you also have an MBA from UVA's business school. Could you talk more about that endeavor and touch on some of the ways God has or is calling you to use this degree?
Yeah, so I decided to go back to get my business degree. I don't think we're going to go get any more degrees, right?
2009 med school, 2019 MBA. I'm like, gosh, 2029 is coming.
Yeah. So I consider myself a lifelong learner, and I was really getting a bit bored. I felt like I wanted to go do something else. And so I, for many, many years, was thinking about business school. In fact, when I graduated from UVA School of Medicine, that was the first year they had a joint MD, MBA program. They had started like maybe a couple years before that. So I thought about it, and then I saw the price tag, and I was like, I'm not doing that at this time. I think I'll just go to residency. So I think I always was somewhat drawn to the business side of medicine, not from an administrative standpoint, because I can do administrative tasks, but I wouldn't say that I enjoy it, overly enjoy administrative things, but just the business side of medicine, like how the numbers work. And that is important because for a lot of health systems and for a lot of healthcare in general, and even policy, like the bottom line, like how much does this thing cost? How much is this policy that you want to implement? How much is this new program at the hospital? Like those things matter, in addition to other things. It's just one of the factors. And so I was always drawn to the business side of medicine, and honestly didn't really understand it completely. And as physicians, we are like faced with the business side of medicine every day, and we just don't, like most of us just like don't even know how to start like the deep dive into it. And so ended up going back, getting my global executive MBA, and so we traveled around the world learning how like different systems operate, including healthcare. It was a general management MBA. Darden was one of the best educational experiences I've ever had, and I probably should just go ahead and say it was the best, even though I work for UVA School of Medicine. I'm sorry, but for me, like it was a really good experience. I got to collaborate with a lot of people from all over the world. And in terms of how I'm using the MBA, probably not as much as I should, given the price tag, because it's even more expensive now than it was in 2009 when I first looked at the price tag. But I will say that on some of the higher level executive type committees that I'm on at the hospital, I do get to marry sort of the business side and being able to understand all that comes with that. So all the finances, the accounting. I did immerse myself in accounting. I learned a lot. All of those sides of it, as well as like seeing patients and seeing that suffering and knowing what like they need. And so in these meetings, I can say like, well, this is what people actually want, and this is what they need, and these are the numbers, and I can hear their numbers and then sort of counter with that. So it makes my advocacy on a higher level much better. In terms of what I will continue to do with my MBA, it remains to be seen. It was a sort of general management MBA, and I feel like it has like a lot of applicable practices. Very briefly started a little startup that I then stopped after my mom got sick and the kids were virtual during the pandemic and all that, so I may pick that back up as well. But still, I hands down, like Darden was just an amazing educational experience. I've since learned that if I get that itch, because I am a lifelong learner, I should just do things that like don't cost money but are fulfilling as well, like no more certificate programs or degrees. But it was a great experience.
It's great to hear.
Yeah.
Thank you so much. And then passing it back, so as a senior policy advisor for equity in the White House, how have you seen God move you to be a voice for justice and reconciliation in your position as both a policy advisor but also as a physician?
Yeah, it's interesting because, when I stepped into the role in the White House, we were 8 months into the pandemic, really. It was January of 2021, and we had already seen so much death. We were coming up on a million lives lost, and people have been hit so hard, not just in terms of the loss of life, but the morbidity, the hospitalizations, the folks who had long COVID, the economic impacts, the businesses and lives destroyed, so much suffering, so much challenge. And one of the first groups who I really partnered with in my role. So when we talk about equity, what we're talking about is everyone in every community having the opportunity to not just survive but thrive through the pandemic. And we started to look around and map out how do you operationalize equity. And so we reached out to different stakeholder groups. Some of it's demographic, right? We look by race, ethnicity, we measure that, and so we reach out to those. But one of my earliest and strongest partners has been the faith community. There's an organization called Faiths for Vaccines who, at this point, they're like my best friends. But, we realized that for the vaccination effort, for a lot of people, what they needed was trusted messengers. And the faith community provided trusted spaces for those messengers to engage at a local level. So churches, synagogues, mosques, temples all across the country opened their doors for people to have conversations about how to stay safe in the pandemic and for people to actually get vaccinated. And so what happened pretty quickly is, yes, I'm working closely with Pace for Vaccines, and then I'm doing all these faith stakeholder calls, and then I'm talking to individual churches, and especially as we were starting to open back up, they're like, how can we get people back indoors? So, it became really interesting, but there's a language, I'm a Christian in terms of my faith, and so, it's a social, it's a cultural, and it's a faith experience. And so when I'm engaging with folks, it's one thing if I'm like, I'm Cameron from the White House. It's another thing if I start talking about Jehovah Rapha and like by his stripes we're healed and like all these different things that people are like, I recognize, I see you, you're speaking my language. And it opened up even more doors to engage with more folks authentically. And so I think that for me, Leigh-Ann always jokes, she's like, you're a wannabe pastor. But I think that for me, it was a really, it was a great experience being able to engage with that community and continuing to engage with that community. So that's one of the ways I see it in my work. And I think one of the other ways is just there's a grounding in terms of how we center this notion of equity. Our government is not designed to serve everybody well, and I know that's probably a tough pill to swallow for some folks, but I mean, I think you all can acknowledge that you've probably seen that play out. And being that dogged pursuit of equity, that dogged pursuit of using the levers and the tools of government to reach and to serve everybody well, that's rooted in my faith. That idea that for the least of those, like we should be doing this service. And actually just yesterday at work, I was talking to somebody and they were like, how do you keep going? And I was like, you got to do this work as you're doing it unto God. And they were just like, you're a fake pastor, But I think that that's kind of, for me, it's been helpful to keep me going, and it's also been helpful to continue to kind of forge and break new ground in the work.
Well, thank you all so much for answering my questions. And so now I'll open it up to anybody on the floor that would like to ask any questions to the Webbs. And I can bring the mic to you.
One over there?
Oh, yes.
Yeah.
Okay, sorry.
How is your work funded?
My work?
Yes.
It's not. So, if you think about it, technically my work, the White House doesn't have a budget. We get our operational funds through Congress. And, saying nothing about our representation here in Virginia's 5th District, what I'll say is that Congress has not been particularly functional at funding things. So we don't have any money left. And I actually work every day with community-based organizations, faith-based organizations who received millions and actually in total billions of dollars to do work at the community level. Those dollars have since dried up, and we don't have and so now we're coming back to them. We're like, we've got these new updated vaccines. We need to reach out. I was meeting with Faith for Vaccines last week, and they're just like, okay, how can we do this work? Because we don't have navigators, we don't have people, and you don't have money anymore. So now what I start to do is coordinate with philanthropy. And I point to the examples of promising practices and things we were able to fund in the past, but I shouldn't have to do that, right? I mean, when we have models that work and when we're still in a crisis in so many ways, we should be able to say, we got to double down here. We asked Congress for $22.4 billion. They said no. So I'm not going to get political here as much as I want to. But what I'll say is that we do a terrible job of funding public health in this country because we wait for there to be a fire and then we try to put it out. But and I always point to our military, and I say when we fight wars, we just keep funding them. We in fact fund the development of tools to help, wars that may happen 50 years from now. But we are in an absolute war right here with this pandemic, and so many of the communities have been the hardest hit. But you can't lift a pen to get some money to the communities who need it. So sorry you got me on my soapbox there, but we need more.
It just amazed me and questioned that because really the community would help, or the charitable churches or faiths would also fund that. And as you said, don't rely entirely on the government. And so that's where it's really good works and out of the heart of the good heart of the people in the community, it can be funded.
It can, but one thing I'll say though, and I do a lot of work with, again, the hardest hit, highest risk communities, and I just can't in good conscience go back to the same hard hit communities over again and say, save yourself, and I'm not going to give you anything to help you do it. I think that there's an expectation that we want so much out of these organizations locally on the ground to make the difference, but we're not willing to invest in them. And so that's where I say, when we see these really great examples of just incredible work, we don't just lift it up in the newspaper. There's an article in the New York Times just the other day talking about the community organizations doing this and that. Yeah, we lift it up because it makes for a good story. But why don't we lift it up with our dollars? Why don't we lift it up with our resources and with giving communities what they need? Because if you continue, if you're able to hire more navigators, hire more people who can do outreach work, imagine the multiplying effect that has. So yeah.
Hello. Hey, Dr. Webbs.
Hey.
So I had a question. Given both of your backgrounds and the education and all the things and the experiences that you all have had, I was wondering, how is it, how do you all sometimes, I guess, I think there's great opportunity for you all to work together, at home, but then in your professional experiences, with a global executive MBA, and then the issues that we have in this country and the things that you're fighting, how is it that you all, I guess, come together to do stuff at home? Because I know busy and lives don't just stop and it's just professional, it's just home or not. And then also the different challenges that you might see in the emergency department, hey, write the policy, get it together, how do you all work together on those fronts?
So a long time ago, we realized, both being in the medical field, that we did not really want to bring that home to us, right? Because we're completely immersed. Imagine working 80 hours a week and then coming home to your partner and then talking about patients. And so I think very early on in our marriage and when we were medical students, we kind of made this line, if you need to debrief or need to talk about something, let's do it. But otherwise, let's talk about something else. Otherwise, we were just fully immersed in healthcare all the time. So I think that kind of set a precedent of just us hopefully leaving work at work. During the pandemic, it was a little bit different because you were just fully immersed. I feel like I'm in crisis mode sometimes in the emergency department when emergencies come in, but it was a public health crisis in a completely different way that I had never experienced before. Sitting at home knowing that you had tools to do something and people were literally dying every day. I was seeing it. I was talking to my healthcare friends across the country in emergency departments. So we didn't actually partner together that much. I guess we worked together. We didn't start anything together. I was doing a lot of things with other people, but I think that's an example of where we were having lots of discussions of, how to advocate, how to implement things, what we could do at our respective jobs during the pandemic. And so, yeah, we haven't really. And I would love to work with you in the future at some point. But also it's really good, it's really good the way it is. And I think maybe that it should be that way for us. We do have 2 kids, they're 11 and 7, and they're fun. In our personal home life, obviously, we work together all the time. It's very, very busy, and I think we are really good at parenting our kids together and in making it work despite us both being really busy professionally. I think we're really good at it. Our kids love being in our family. My daughter the other day actually said, and she's in middle school, she's I love our family. We're fun. I was yes, this is what I live for. This is the most important thing you've ever said to me. But we may work together somewhat in the future.
The only thing I'll add is that, when you've got a wife this high-powered, right, a lot of what I try to do is hold space for her to do her thing. And I feel grateful that she's also done that for me. We talk about kind of the different seasons of our professional lives where sometimes I take a step back so she can do what she wants to do. When she's getting her MBA, and then other times when I hey, I think I want to run for Congress. She's okay, And I think that because of that, some of our partnerships, some of our working together is by giving each other the space to do some of these things. And that's an extreme and a radical form of love in a lot of ways. So I'm grateful for that. And hopefully I get points for saying that.
Yeah, totally.
Are there any other questions? Oh, yes. Come back. All right.
Yeah, I can speak from here, I think.
Okay,
Yeah.
sure, yeah.
You used the term navigators
Mhm.
2 or 3 times. What did you mean by navigators?
So I'll give you an example. Here in Charlottesville, one of the conversations I've had more times than I'd like to count is that there are people in the black community in particular who say, you can't pay me to go to UVA hospital. And they say, I was born in that basement in the West Complex, that segregated ward. That's who UVA is to me, right? And when you think about that dynamic, that's a lived history. That's not, for so many of us who look in books and see the, black and white photos, that happened back then. For some people, that is their lived experience. So when you talk about navigators, there are people who just are not connected to the healthcare system for good reason, because of trust dynamics, because of lots of different dynamics. A navigator is somebody who then kind of comes in and reconnects, helps you navigate. I remember one time I was walking down the street and a guy was walking around pacing in front of the emergency department, and I just asked him, I was like, hey, can I help you? And he's like, I don't know where to start. I need help. I don't know if I go there or to that big building, but I just don't know where to start, right? And so that model has been established in public health for a while now, this idea that if you have people who are from community, in community, who can talk to people and help them navigate this incredible matrix, not just of healthcare, but insurance and all these things, then they're gonna have better outcomes. In the cancer space, that model's been really well established because cancer navigators help achieve some of the best outcomes that we see, because you have somebody who's there with you for your health journey. And I think with regard to COVID-19 specifically, there was so much mis and disinformation out there, and people are thinking, well, how do I get a test? How do I do an at-home test? My test is positive. Who do I talk to? What do I do next? That's where community health workers and promotores de salud and folks who could help people navigate this new space of COVID-19 have been really critical to the work.
And in the meantime, in healthcare and healthcare systems, we also need to do a better job, right? We can't just leave it all up to patient navigators. We need to make the system from a business side, insurance side, much less complex for patients, and then from an actual clinical side, where from the moment that you walk through the door of the hospital, actually before you even do that, in the moment you are like, I'm sick and I need a provider, or I need to follow up with my primary care doctor, we need to start making that an easier process for people. We talk about that a lot and do some work in that space with medical design thinking. It's just thinking about lots of different people in lots of different circumstances, and how do we make it easier for them to navigate the health system. That's a big job because it's such a complex thing, but patient navigators are excellent at helping patients navigate through that space. Yeah.
It's a kind of a follow-on, so thanks, Graham. So that navigator answer gives me such a great idea, because I recently had a conversation with a young person very close to me who majored in poetry at UVA. And so she had read the stories about hospitals in our area who were hounding patients for payment. And there's all sorts of corruption. She was just completely outraged. She's like, I'm going to go back to school and I'm going to be a nurse. And I was like, maybe there's another way, because she was not strong in biology, she's strong in poetry. So she's like, well, what about public health? Like, what should I do? So first of all, how do you become a navigator? What might you suggest to her? She kept talking about public health. I think that was just a category that she had heard of that felt like maybe a direction. So what about like a young person seeking a path to support your work? And secondly, if you all sent us out today to do one thing, what would it be? Those are my 2 questions, and I'll give you the mic.
Sure. So on that idea of how to become a navigator, some of it just comes down to knowing who's in this space, what kind of community organizations are doing this work. And so, a couple places I would point, I think the local health department often has a sense of kind of who and where people can plug in.
Which department?
The local health department, so Blue Ridge Health District. During the pandemic, actually, they were hiring a lot of navigators. And I say during the pandemic, I'm speaking specifically about the height of kind of the surges back in 2020. I think that as we've moved farther into this hazy window where people are like, it's still the pandemic, but we're moving toward endemicity, that, where it's here and we know it's not going to go away, but we can navigate it differently. I think this is a moment where we say, well, are those dollars still there? So I don't actually know the answer to that question, but I think the health district is a good place to start in kind of navigating the public health environment here. But I think that there are different organizations at different points over the last 2 years who've really stepped up into that space. Church organizations, other community-based groups. And so I think just kind of doing a search, looking around, seeing who's been doing the work can be a helpful approach. And the second part of your question was?
If you could send us all out to do one thing today, what would it be?
Yeah. Man, so first I'll say everybody has different gifting, right? Everybody has different things that they can add into the space. So I would say take your passion and align it with your purpose. And if it's having something to do with health, I'll say health is in everything. Health is in all policies. Health is in education, it's in food access, it's in housing. Whatever your passions are, understand that as you apply yourself, your capabilities to those spaces, you're going to be helping with that compelling moral endpoint of better health outcomes. But I think that if I'm sending folks out here to do something, the biggest thing I'm sending you out here to do is to listen to the community around you. Especially if you're connected to UVA, the dynamics between the town and the gown, as they say. That hasn't gone away. People still refer to UVA as the plantation. As you navigate Charlottesville and as you pass through this place, I would say be respectful, be engaged, be a part of the community. Don't exist solely in a UVA bubble, but really immerse yourself into being a member of this Charlottesville community. And I think that's going to change the footprint of what UVA and what institutions like ours are able to do in that space.
Yeah, I'm going to be a little bit more concrete and less inspirational as I am. And I will say I will send you out to go sign people up to have financial assistance at UVA for the people in Charlottesville who would also like to come to UVA, obviously. We have a great sliding scale system for financial aid that a lot of people don't know about, and some do. But we have... It's for anyone who can qualify for financial aid. Like there's a cutoff, it's for students. It's for any patients in the community. There's a sliding scale for how much you have to pay when you come and get services at UVA, and it can help tremendously. And it's out there. It is, we're working on trying to make it a more streamlined process. So we have people at UVA who, can help you through the paperwork, but it is paperwork, right? And we all know that paperwork is a barrier to anything. And for most people, not just people who really need financial aid, like paperwork is a barrier for me too. I put it off as long as possible. So I think people need hands need to be held, like here it is, this is how you figure it out, this is how I can help you along the way for both motivational purposes, accountability, so on and so forth. But I think that'll open doors for a lot of people who feel like they can't get care or who feel like they can't afford care. So we do a little bit of that at like health fairs and other things, but if we had like a whole workforce to just say, hey, this day I'm gonna, if you want help, like here you go, here's the paperwork and I'll help you through this, like that's extremely helpful for people. And again, we have that, but like I think, rather than having people just come to us, right, and ask for help, going out there and letting people know what we have at my health institution in particular, and helping them through that process is incredibly important. Mm-hmm.
My question was very similar to Karen's, so I won't repeat hers. The first half of the question is, are you aware of cross-grounds initiatives where people from different disciplines can get involved in the kind of health promotion things that the two of you are passionate about? And if so, what are they so that these people can jump into those things?
Yeah, I'm gonna blank on the name. I think it's called Three Cavaliers. Is it Three Cavaliers? There's a program where if you're part of the University of Virginia at large, you can actually collaborate with physicians, whoever else. It's just three professors, three people who are on faculty or staff at UVA, and you can collaborate across grounds and get funding for whatever you want to do. So that's one formal program, but I've found UVA to just be an extremely collaborative place. Like, I don't think I've ever reached out to anyone like interested in their work or interested in having a cup of coffee to talk about something new or innovative, whether it be like truly like in clinical care or like in the medical design thinking space, and had them say no. So I think people here are like inquisitive, they want to help for the most part, and so I would encourage you, like if you want to collaborate with someone, to just reach out. But then there's the funding aspect of it as well, right? And so then you can go through a formal program like Three Cavaliers. There are actually like a few other smaller programs and grants, but I don't know the names of the program off the top of my head, but if you email me, I'm happy to look those up and send them your way if you'd like.
Thanks.
Yeah.
And then,
Well, just real quick, I think one thing that I'm passionate about is community-centered design. So, the less that it's about, UVA people, and the more that it's about partnering and engaging in community. The history of universities and institutions saying, we are going to do this for you because you need it.
It's hard.
That has been the model, and it's wrong. The way that we do research, we're going to extract information from you so we can publish it in this journal and promote ourselves in our career, and meanwhile we left you with nothing. So I would just say, in whatever you do, again, going back to that idea of really centering the community in it, including its design, including what ultimately, how they hear back what the results of your work are. I mean, that just doesn't happen. And I know the Equity Center, which I've been a part of since it was started here at UVA, that was a big part of the goal. It was like, how do we turn this around and get information back to the community and stay engaged, kind of the institutional review board having a community-based one. So I think those are just things, again, in terms of design principles, something to keep in mind.
you anticipated perfectly the second half of my question is, with a design thinking framework, if you got to imagine a thriving Charlottesville, where regardless of the policy stuff that's going on 120 miles north of us, what are the ways that you would love to engage every member of our community in crafting that thriving community, and how might some of us participate in that in the year ahead?
Yeah, that's a big question.
Because I want to see change here, right? Like, I want you advocating in DC for us,
Yeah.
but I don't want to wait for the folks who can't agree with each other to get stuff done here.
Yeah, I mean, if you really lean in on the principles of design thinking, then you don't, like I wouldn't plan out these things. I would just get a group of stakeholders and people who are interested and kind of just start from scratch, tell them that there are no limitations. There is no budget, right, to this project. You have all the resources you need to imagine this thing, and then you really come up with something together with that sort of as an end goal in mind. But I would love to see like healthier places and spaces throughout the community, especially for communities of color. We have a lot of that here in Charlottesville for other communities, but I would love to see healthier communities right here in the city where you have like the walkability, you have healthy food in the neighborhood, right? You don't have to go out, and let's make it affordable too, like, right? So you can get a bag of Cheetos for like $1.25, but it's really hard to get like healthy food at the corner store. So I would love to see like healthy spaces and places. I would also like to see where we have some of the development in Charlottesville coming into some of these neighborhoods for them to hold spaces like community spaces where kids can come after school and they can get help and tutoring and fresh food and whatever it is that community needs. But that's just me thinking off the top of my head. I completely agree with Cameron in that those spaces are nice, but you really have to go into each community, right, and they're all very different, even though they might look the same, and say like, what do you need here? Like, what do you need in this space, and involve them in that design process. Because as much as I would love to like sit here or have a cup of coffee and talk about it, I'm not in some of those communities that I'm talking about, right? And so you really do need the buy-in of those communities. I will say that like one of the most successful, I would say community service project, because we didn't get payment for it, but it was the COVID-19 children's book that Cameron mentioned earlier. So I did collaborate with another physician, Ebony Hilton at UVA, and my sister-in-law actually, who's an Ezra Jack Keats award-winning illustrator. Again, we were sitting at home, just kind of with this anxious feeling, like we should do something, right? And so we all volunteered our services. She illustrated it. We made this book. We published it as an ebook and put it out into the world, and we used a couple of people from the community to get it to some people. Then someone from the community was like, we love this, let me give you $20,000 to have this book printed so we can put it in clinics and actually drop it off at the Boys and Girls Club in different communities, right? And then Books on Bikes took it. And like, you know, like, so really we started it, but then the community was like, yes, this is valuable to us. And then they took it and did what they needed to do with it. We never saw a penny of money or anything like that. So that's like a successful project where I feel like we kind of collaborated with each other, collaborated and got feedback from people in the community, like, would this be a useful resource? And then they just took it and ran with it, which is the way it's supposed to be. Like, I'll be seeing patients in the ED, somebody else can be, you know, like reading the book to their kids at home, or on Books on Bike passing it out. And so, yeah, you have to have the community involved, and then just let it be theirs too. If that's what they want, just let them have it. So.
Yeah. I would say three things. First, and this is kind of your question about how to create a thriving Charlottesville,
Yeah.
or how, more importantly, how we can be a part of a thriving Charlottesville. First is acknowledge our history. That practice of naming and acknowledging is restorative and is, I would say, essential to the work. And I don't think to the satisfaction of the community we've done that yet. So I would start there, right? That kind of truth and reconciliation model. The second thing I would say, and we live in the county, so when I say Charlottesville, I think even beyond the city and also into the surrounding county. But if you look at our education system here, there's no reason we should have the incredible gaps in education that we have with a world-class institution right here. It's unacceptable. It doesn't make sense. A thriving Charlottesville invests in education from day one, actually from the womb into when kids go through school. Every single child, and yes, I'm getting into policy here, but every kid who succeeds in local schools, Charlottesville, Albemarle County, should be able to come to UVA. Right? Like, we should have this idea where this is their university first and foremost, right? And so I think investing in education, I think, is critical to that idea of a thriving Charlottesville. It's good for the kids, it's good for families. It's really important. The last thing is we've got an affordable housing crisis here in Charlottesville. We continue to have one. And you want to know who the biggest perpetrator of that crisis is? It's UVA. Like, what we do to the footprint here, and what we have done, if you look historically, to the footprint here has made it harder for people who work here, some of the hardest hit, highest risk communities, to be able to thrive here. And so how we fix that, right? There's a new, student housing place popping up every couple months or years, right? How do we say this is space for the community to be able to afford where they live? This is how we're gonna exert our incredible economic impact in this community on helping make sure it's more affordable for the people who live here. If you can afford to live here, if you can educate your kids here, and if you feel like this is a place that's for you, and that you trust that, you believe that, and you feel like we're redressing some of those historical wrongs, I think that's a huge foundation for a thriving Charlottesville.
Mm-hmm.
Thank you both.
Any last questions?
My question is a little bit amorphous still, but Dr. Cameron Webb, you mentioned earlier that the system is not designed to protect everyone. Okay. You mentioned earlier that the system is not designed to protect everyone, and so I'm sort of wondering if you have ultimate faith in that system, like in being able to ameliorate it and amend it from like the top-down policy approach, if you see through your work like curving towards justice, and if not, like what is it, grassroots? Like what? Yeah. I mean, is it a revolution? Like what is? This is something that I like, a really big question that I often struggle with.
No, it's a great question, and I'll say, Leigh-Ann knows as well. We have a network of friends who do a lot of equity work, particularly around health, and they'll be all riled up and angry and upset about something that's like directly tied to a policy I'm working on in Washington. And what's interesting is that the dynamic isn't they're like, I'm mad at Cameron for this. What they recognize is the work that they're doing at the community level, I'm trying to do that same work in a different space. They know my heart, they know what I'm passionate about, and we're working in different systems. I think it requires all of it, right? You need folks at the grassroots, folks at the grass tops, folks in local leadership, state leadership, and federal leadership. When you ask, is this system designed to serve people right now? And I say unequivocally no, but part of why is I look around the rooms and they don't look like everybody. It's impossible to design good policy that serves everybody if their voice is literally not represented in the room, And so that's where I say, if you want a revolution, the rooms across our country need to change. The rooms that create policy, that implement policy, they need to change to look like the country that we live in, right? And so I think that's really where the key is. And so absolutely we need to have a revolution, whether that's a political one, whether that's an economic one. There's just a lot of work to do for, I think, and again, I'm at risk of sounding political, I think there's so much potential for our country to really serve everybody incredibly well, because we've seen people thrive to the highest heights in this country, but we've seen people left behind with no regard. And so we can do better than that, right? And I think that the way that we do is we make sure that voices are at the table, that voices set the table. Voices, create everything, as from Hamilton, I designed the menu, the venue, the seating, right? Like, you want to make sure that everybody is there so that they can really drive what we see. And that's not going to happen overnight. In the meantime, I will say, and Leigh-Ann's heard me say this so many times, the pressure from the grassroots is helpful to me. And I don't make any bones about it. When I'm in the White House, I'll tell people, I'm like, oh, the community's mad, we need to do something. And sometimes at the same time, I'm like pushing the community. I'm like, hey, get mad, I need it. I need some anger so I can then take this. It's all one system. So.
Well, I think that might be a good place for us to stop. Thank you all so much for being here. Thank you, Cameron, for leading this. And there's more food. Feel free to linger. I just want to give a quick announcement before Karen gives our blessing. We have another Faith and Work in a month, November 3rd. And actually, I feel like there'll be some carryover of this conversation. It's with Frank Alexander, who started the Faith and Law program at Emory. And he's coming. He'll be giving a public lecture on vulnerable communities and the intersection of environmental justice. He'll be here on Thursday, November 3rd for a conversation. If you all want to come back, we'd love to have you here. So thank you.
Thank you so much, Mr. and Dr., Mr. and Mrs. Dr., Leigh-Ann, Cameron, Webb, and to all of you, each of you for coming, especially the students. We just are so encouraged to see you here, and we hope you're inspired to get mad and do the work in the grassroots or wherever you may find yourself. We have a customary blessing here at Theological Horizons, so I'd like to speak these words now. May the Lord Christ go with you wherever he may send you. May he guide you through the wilderness, protect you through the storm. May he bring you home rejoicing at the wonders he has shown you. May he bring you home rejoicing once again into our doors. Amen. Peace, friends. Thank you.